infectious disease doctor, but I'm not ophthalmologist, but I will explain why I'm doing this research and trying to show you my work here in Brazil. And within the last 28 years of work in the health field, I've been studying other significant medical traditions, such as traditional Chinese medicine, Ayurvedic medicine, and Hippocratic medicine. And today I will present this keynote presentation entitled Energy Alterations and Chakras Energy Deficiencies as the Cause of Subretinal Fluid Retention in Polypoidal Choroidal Vasculopathy. And before I present my study, I would like to show you how I began all my studies in all kinds of treatments, in all kinds of specialties. And this case started in 2006 when I received in my clinic an Afro-descended patient, about 70 years old, male patient, who came up with a symptom of pain in both legs, and he was taking anti-inflammatory medication and without any improvement. And the patient reported feeling cold in the lower limbs, had normal day bile habit, and did not present sweating or had no dry mouth or body itching. And this patient reported no other complaints at this point. And these informations are very important in the traditional Chinese medicine diagnosis, and the physical examination was apparently normal. And according to traditional Chinese medicine, he had kidney yang deficiency in the energy point of view diagnosis. As for the complaining of feeling colder in the lower parts of the body, in the legs. In traditional Chinese medicine treatment, I indicated the patient auricular acupuncture twice a week during 10 sessions, and he improved from this condition and returned only 1 month after the last session to be reevaluated. And when he was interviewed to know if there were any intercurrences, he reported that he had gone to his ophthalmologist and that the doctor was surprised about his intraocular pressure. And the patient had not reported me that he had glaucoma and was receiving treatment for his eyes for about 40 years. And the pressure levels of his eyes would never low, always appearing as about 40 mmHg. And for this first time in his life, the pressure was about 17 mmHg. And the ophthalmologist asked the patient what he had done differently since his last consultation. And the patient revealed that the only different procedure he had done was acupuncture. When I started the acupuncture treatment, I was not aware of the patient's glaucoma. However, I was treating the energy imbalances which led to the pain in the legs, was the root of the problem leading to the glaucoma too. Therefore, the treatment of the patient's energy imbalances led to the improvement of many other symptoms and or disease that he had, which I did not know about it. And in traditional Chinese medicine, many diseases can be treated using the same method because many different diseases have the same root, the same intrinsic cause associated with energy imbalance. As I had great success, I decided to present this case at the American Association of Medical Acupuncture Congress in Baltimore, the United States in 2007. And from this case study, several other studies started to be developed in most variety specialties, all involving the root treatment of the problem, which is the energy imbalances and not only the symptoms. And also after this case, I started as a research firstly supported by the University of São Paulo in Ribeirão Preto, Brazil, in the ophthalmology department in the glaucoma session, to demonstrate that the treatment of energy imbalances can cause a decrease in the intraocular pressure. And this case was also presented at the Society of Acupuncture Research Congress, which took place in Boston, in Harvard University, United States in 2015, entitled Acupuncture Viewed Holistically Can Treat All the Patient's Disease Simultaneously. And after this study, several others took place regarding the treatment of most varied pathologies. This is my clinic, and I'm able to see every day the effectiveness of ancient medical techniques for many diseases, including ophthalmology problems, such as this problem I'm presenting to you today, the subretinal fluid retention in polypoidal choroidal vasculopathy. And I will present now this disease in Western medicine is characterized by multiple recurrent serosanguineous bilateral retinal pigmental epithelial detachments. And the cause of such manifestation remains a controversy. At first, polypoidal choroidal vasculopathy was described as a clinical entity different from neovascular age-related macular degeneration, and it would consist of subretinal polypoidal vascular lesions linked to serous and hemorrhagic pigment epithelial detachments. And after the first description, several other reports started to be published around the world, revealing differences in the condition among different populations and ethnicities. And the classical clinical findings of this disease is the presence of reddish-orange subretinal nodules, and they can be small, medium, or large in size. And the larger nodules are easily seen clinically, especially when the overlying retinal pigment epithelium is thinned. But Western medicine involving understanding in this pathogenesis and the features of this polypoidal choroidal vasculopathy and the optimal treatment modality has been changing through the years, and currently a number of treatment options are available for this disease in Western medicine, including thermal laser photocoagulation, PDT monotherapy, anti-VEGF monotherapy, and a combination of therapy between anti-VEGF and VPDT. And now I will begin to describe one case report of a patient that has this eye disease, and she is a female of 47-year-old. She started noticing a great spot in the central region of her right eye, and the patient searched for an ophthalmologist and was diagnosed with incipient macular degeneration. Not satisfying with the diagnosis given by the doctor, she looked for another ophthalmologist in her city who, after performing several exams such as fundus, OCT, visual acuity, and others, referred her to another ophthalmological center in another city because possibly she had polypoid choroidal vasculopathy, and in her city there was no treatment for it. And in December 2007, she sought the center in another city, and the diagnosis was confirmed of polypoidal vasculopathy in the choroid in the two eyes. However, only the right eye had subretinal fluid. This is the exam she did. And in January 2008, she underwent a laser procedure with a medication called Visudim, and there was a decrease in the liquid fluid, but not completely eliminated. In 2009, 2010, 2011, she performed 3 more applications of the same laser with the same medicine, Visudim, without much success. And with this right eye, she began to see very crooked lines. In July 2011, when the subretinal fluid appeared in the left eye and the laser giving little result, she asked to be referred to the University of São Paulo at the Ribeirão Preto city, and she conduct and they conducted different the case. She started treatment with injection in both eyes of the medicine called Avastin, and after a second medicine called Lucentis, administered as an injection in the eyes under a local anesthetic medication. It's also used to treat damage to the retina caused by leakage and abnormal growth of blood vessels in disease such as the wet form of macular degeneration. It's worth mentioning that 2 days before the injection, she dripped one antibiotic medication and one anti-inflammatory medication in the eyes to prepare for the application. And at the beginning of the treatment with the injection, she even performed them every 15 days due to bleeding from these vessels. And when this bleeding ceased, injection continued every 4 to 5 weeks, and the subretinal fluid sometimes decreased and sometimes increased. And the great spot noticed at the beginning of the diagnosis disappeared, and the lines became less crooked. And the sequels were that with the left eye, she saw the smaller letters of their real size, and with the right eye, she saw clearly in the central region. However, the lines above and below were, she cannot read the words. In 2012, a new drug was discovered called Eylea that contains aflibercept in its composition, and in the case of this patient was better than the 2 others. Sorry that I'm not ophthalmologist. That's not the medication that I usually use. In 2013, the day after the application, the drug Eylea in the left eye, she began to see several black spots all over the eye, which made her see her doctor in Ribeirão Preto to the next day. And she was seen by the resident doctor, who told her that the vitreous in her eye had taken off and would return to normal in 7 days. But the problem only got worse and worse, and she returned to the clinic the next day, and she already had this staphylococcus infection in the eye, and she was immediately taken to the operating room at this hospital, and several exams were done, including culture, and she started to use antibiotic medication and antifungal medication as eye drops. In 2013, the patient was diagnosed through mammography that she had cancer, breast cancer in the left breast, and she treated with surgery and radiotherapy. But in 2015, she had another diagnosis of cancer in another breast, and she needed to perform the bilateral mastectomy for this reason. And in October 2017, she had another infection, affected his right eyes after an injection of this medication Eylea. And this infection was much more difficult to treat or cure, but the doctor attributed this infection due to her sinusitis. And she did all the treatments, and she was referred to another hospital in São Paulo to treat this infection. And after consultation with this specialist, it was indicated to have a vitrectomy surgery and remove it from the after 3 months to do the cataract, and that is what she did. And this is the exam she did in March 2020. And in 2020, well, She was my patient in 2011 during acupuncture session, but from 2011 to 2019, she stopped the treatment, and she started the treatment of acupuncture in 2019. And after the acupuncture sessions, we noticed that the fluid of the subretinal was improving because there was a lack. She started last year and stopped the treatment because of the coronavirus infection. And she stopped the treatment during March 2020 to September 2020. And after she restarted the treatment, the doctor in the ophthalmology doctor, he noticed that the fluid in the retina was decreasing or reduced or were absent completely. And her treatment consisted of acupuncture with apex ear bloodletting, and we replenish all her chakras energy that was in the lowest level of energy with high diluted medication and crystal-based medications. And we change all her dietary aspects because the ingestion of raw food, the dairy products, cold water, and the sweets were causing an imbalance of the spleen pancreas that was causing the retention of liquid in all her body, including in her eyes. And this was the exam she did in June during the acupuncture treatment. You saw that the liquid disappeared here, and here is only a demonstration that the Western medicine treats the system separately. And it's different from the Hippocratic medicine and traditional Chinese medicine, where all the disease came from the imbalance. According to Hippocrates, all the disease came from the imbalance of these four humors, that yellow bile, blood phlegm, or black bile. And in traditional Chinese medicine, all disease came from the imbalance of the five elements, or from the yin-yang theory. And the wood, fire, earth, metal, and water, they are interconnected by an energy point of view. And the wood element has the liver as the internal massive organs, and the liver is responsible for the eye, and the imbalance of the earth is responsible for the retention of the liquid inside the body. And that is why in this patient, she had no energy in any of the five elements, leading to the disharmony in the equilibrium of these energies, leading to this kind of the disease in her case. This is only to demonstrate that the eye is commanded by the wood element, that's commanded by the liver, and the earth element is represented by the spleen, and every element has the command on external sensorial organ, and the eye is commanded by the liver. And in this example, the kidney commands the ear, the lung commands the nose, the sense of smell. And here is to demonstrate that all the elements are interconnected by the energy flow, the generation cycle, and control cycle. And here is to demonstrate that the liver meridian is responsible for the energy. In this case, the liver is responsible for the vision. Here is to demonstrate that all the emotions are linked to one specific energy, and in the liver, the energy that could induce the damage in the eye is the anger, but the excessive worry can lead to the spleen deficiency and lead to retention of liquid that is demonstrated in her eye. But this retention is not only in the eye, is the retention in all her body, but is manifesting in this case in her eye. And here is to demonstrate that all disease begins with the emotional issues. And the case of the liver is responsible for the eye, the emotion, that the imbalance is the anger. But in her case, excessive worry or the excessive fear can also lead to imbalance of the liver and lead to the alterations in the eye. And here is one publication about the spleen disharmony leading to the excessive fluid retention is linked to spleen stomach deficiency in traditional Chinese medicine. Here we are demonstrating that in the eye problem, we need to search for the root of the problem, that is the energy imbalances. And in this case report, we are demonstrating that all her 5 elements were in the lowest level of the energy, leading to manifestation in her eye. But the eye problem is only the tip of the iceberg, but all we need to treat is the root of the problem that is under the earth, below the earth, that we cannot see by the naked eye. And here is to demonstrate all the nutrition point of view that we took out from her diet to have the improvement of the energy balances, to take out all the cold water, raw food, dairy products, and sweets. And here the foods that could induce the liver disharmony, that the fried food, chocolate, alcoholic beverages, honey, coconut, and eggs that could lead to injury of the liver, responsible for the vision. And here is the foods that could induce the imbalance of the kidney, that can induce the retention of liquid in the body too. That's coffee, soda, and matiti. And here is to demonstrate the need to have the yin and yang balance in this treatment to have a successful result. And here is to demonstrate that we need to balance and replenish the energy of the internal organs to have an improvement of the symptoms and disease, not only in this case, but in all the treatment that I usually treat. I treat the balance of this internal energy, leading to the improvement or cure of the disease. And here I'm demonstrating the necessity of balancing all the 4 energies, yin, yang, qi, and blood, to have a successful result of this treatment. Here is the acupuncture points that I usually use in this treatment. I'm using the apex ear bloodletting to take out the heat retention that is produced when there is some energy deficiencies. And in this case, her energy were in the lowest level, and that is why she was producing the heat that we need to take out in the apex ear. Because if you treat the energy imbalance and don't take out the heat, the symptoms that she is presenting would worse, and that's why you need to treat the heat and then tone the energy. Here is the kidney, liver, gallbladder, spleen, lung, heart. All these has an energy responsible for the energy production and to improve her symptoms. Here is to demonstrate the chakras energy that were in the lowest level of energy from 1 to 8. All her energy were in the lowest 1. And here the radiesthesia procedure that we did to measure her energy. And I'm showing all her energy were in the lowest level. Here is the the medication that we use to treat her to replenish all the internal organs, to using high diluted medications to replenish the first chakra, that's liver. We use phosphorus. The second chakra, kidney, we use natrium muriaticum. The third is the heart, we use sulfur. The fourth, we use the silicia. And the fifth, the spleen, we use calcária carbonica. This theory was created by me in this publication because in Brazil, I don't have the Chinese herbs to treat this kind of patient, and that's why I create one theory using the high diluted medication, more cheaper than the Chinese herbal medicine that all the population can use to treat their disease. And here's the Arnschutz law, why I'm using highly diluted medication instead of high concentrated medication to replenish these energies of this patient. Because if you use highly concentrated medication, this medication will worsen even more the energy of the patient that it's low. And that is why I'm using highly diluted medication to improve all her energy in all her chakras and to improve the flow of the energy in all her body, including the eye problems. And the conclusion of this study is that to treat a patient with subretinal fluid retention and polypoidal choroidal vasculopathy, it's necessary to see the patient as a whole, not only looking to the symptom in the eye. And the necessity of understand better the mechanism of energy alteration involved in the formation of the disease is important to better treat this kind of a pathology. Here's a Hippocrates quote: it is more important to know what sort of a person has a disease than to know what sort of disease a person has. This means that we need to treat the patient and not the disease. Thank you for your attention. If you have any question, you can ask me now. Thank you.
Yes, thank you, Dr. Huang Wei, for your excellent presentation. So, anyone, is there any questions to Dr. Huang Wei Ling? Yes, is there any questions?
Hello, Dr. Huang. Hello, Harshita. Can I ask something?
Yes, please.
Yes, please.
Very interesting presentation. It's out of our ophthalmology, but very, very interesting for us, like a doctor. Can you say something more about what kind of food do you prefer for diabetes or macular degeneration?
Yeah. Are you saying about what kinds of food you need to advise a patient to treat the macular degeneration? And it's the same, all the treatments. You need to advise the patient to reduce the imbalance of the cycle of the 5 elements and to maintain the yin and yang energy balanced. And the first step is because in all my patients, I did that measurement of the energy to see how is the internal organ energy. And I did research in my clinic from 2015 to 2020. And I am demonstrating in this research that more than 90% of the patients had no energy in any chakras nowadays. All my patients. This means that all the patients, the first way that our body absorbs the nutrient is from the 5th chakra, that is the spleen, and through the foods. And when we eat the food, but we are not absorbing normally the nutrient that we are eating, it will not transform the blood to nourish all the internal organs. And in this case, the vision that the organ that is responsible for the vision is the first chakra, that is the liver, that commands the eye. And the first and the second chakra, that is the kidney. And if we are not absorbing adequately the foods that we are consuming, all the internal organs are in the weakest energy, and that is why there are some eye problems related with this weakness condition of the internal organ. And that's why we need to advise the patient to reducing or avoid the consumption of all dairy products, the cold water, raw foods, and sweets that is imbalance the absorption of the nutrients. And the second way to our body to have energy is through the respiration. And through this research, I'm demonstrating that more than 19% of the patients have no energy in the fourth chakra, that is the lung. That is why the lung is weak too. And all the energy from the respiration process is not adequately to produce the energy and to give energy to the organs through the respiration process. And that's why nowadays we are having so many problems with the coronavirus infection patients, because majority of the population of our world, I think, are in the weakest level of this energy, leading to a weak immunity, because energy is immunity. And that's why it is very important to treat the energy imbalance, to treat the eye problems. And in China, it's very the eye problems is the best organ to treat using the acupuncture and other kinds of tools in traditional Chinese medicine, because the eye is the first organ to improve. And when you use this kind of treatment using acupuncture and Chinese dietary counseling and other tools. Okay.
Yes.